It's Family Health Experts on Local 6 Midday. Dr. Whitney Cope of Audiology and Hearing Center, Paducah and Murray, our guest on this segment, and we'll entertain your hearing questions at 1-888-208-6946 if you have any of those, and we'll get to those in the next 3 minutes or so. And being a new year, a lot of people have a resolution of, I want to get healthy. Probably right up there with most of them. And Dr. Cope, let's talk a second about how closely related are hearing and good health. I'm sure there's a correlation there.
There's definitely a correlation with, several factors of your health. One of the most popular is cardiovascular health is, strongly related to hearing loss. There's several studies, but one of the main studies shows that people who have cardiovascular disease are about 54% more likely to have hearing loss. So, that's something important to keep in mind if you do have any kind of heart disease or anything like that.
Do we know why heart disease is so closely related to hearing loss?
Yes, so your inner ear is very vascular, so any disruption in blood flow like that can affect your hearing. So obviously, any cardiovascular event can affect the blood flow to the ear as well.
I have a question from a viewer who says, I have ringing in one of my ears. Can anything be done about that?
Definitely. There are several red flags that we look for whenever we're checking someone's hearing, and one of them is any unilateral hearing loss, tinnitus, anything like that. And tinnitus is another word for the ringing in the ears. So the first step would definitely be to get a full evaluation of your hearing to see what's going on, because you may need more evaluation from, a medical physician like an ear, nose, and throat.
Another viewer's question is someone who says, I have hearing aids already. I can hear, but I do have trouble understanding people. Is that a problem with my hearing aid?
It could be. It's hard to say. I would go back to wherever you got it and see if they can tweak it. But most often, people have hearing loss. The most common issue is the difficulty understanding, and that again is just related to the nerve damage of the ear. So, it could be a hearing aid issue. It could be kind of the nature of the beast with the hearing as well.
I have about 45 seconds left, and that brings us back to one last question. And someone says, I think I heard Dr. Miliano last year talking about how hearing loss is related to dementia. And can you expand on that just a bit?
Yes, so that's the #1 area of research right now in our field, is the relationship of dementia and hearing loss. And it's more untreated hearing loss. So if you have hearing loss and wear hearing aids, your chances of, developing dementia from that are, go down. But, we definitely want to get the hearing loss treated because over time, without that stimulation, your brain can actually shrink.
And we do want to invite you to stay tuned. Coming up today at 12:30, Hearing Solutions with Dr. Miliano and the staff at Audiology and Hearing Center will be on. And a lot of the extra questions you have may be answered in that show. That is today between 12:30 and 1 right here on WPSD Local 6.